So good afternoon, everyone. My name is Margaret Horlick-Romanowski. I am assistant professor at Brooklyn College. And on behalf of the Center for Health Promotion and the Department of Health and Nutrition Sciences at Brooklyn College, I welcome to you this talk. Again, this webinar is recorded and we will take questions in the chat that will moderate towards the end of the presentation. And without further ado, I want to pass it over to my co-host, Professor Kay. Again, welcome.
Good afternoon. My name is Jolanta Kruszanicka. I'm a faculty at Health and Nutrition Sciences Department of Brooklyn College. And I would love to introduce Dr. Ted Long, who is the Senior Vice President of Ambulatory Care and Population Health at New York City Health and Hospitals. This is the largest public healthcare system in the United States, just a reminder. But Dr. Long is also an executive director of the New York City Test and Trace Corps. This is the program that is responsible for COVID testing and tracing, including vaccinations. I don't want to, say a lot because Dr. Long is going to definitely introduce the program. I also have to add that Dr. Long is a practicing primary care physician. So he has both two hats or triple hats on his head because he has direct access to patients and gets feedback from them. On the personal note, I would like also to let you know that I have been attending meetings with Dr. Long for the past almost 2 years on behalf of the Community Advisory Board under Test and Trace Community Advisory Board. And I have witnessed his reports, his feedback on any of the community issues. His fantastic skills of organizing events or being very helpful and responsive to needs that are coming from the community. So I definitely appreciate his presence here and that he could share some of the just part of the experiences that actually I have been able to see or witness or trying to push to change, and how the test and trace will evolve to be the largest program in this country. So, Dr. And I also would like to let you know that unfortunately we have only 45 minutes, so now it's like 40. Less than 40 minutes for this presentation. So we will try to, squeeze as much information as possible and have a few minutes for questions and answers. But Dr. Long has a very tight schedule, so he will have to leave sharp at 1:15 unless something has changed since last night when we confirmed for the last time. So welcome, Professor Long. Nice to see you again.
Thank you for having me. Just to make sure, can you hear me okay?
Yes, absolutely.
Okay. Well, I've been very much looking forward to coming and speaking with you all today. So thank you for the opportunity to talk to you a little bit about our COVID response in New York City and to share some reflections on what we've gone through together as a city. So if it's okay, Professor Kay, I think you're gonna control the slides and we'll walk through them.
Yes, I can definitely project the slides. Hold on.
Okay, so just give us one moment.
Okay. Yes, you can start.
Okay, so let's dive right in. We can go to slide 2 to get started. So what I want to do today is talk to you a little bit about the backdrop of really what we initially saw with COVID, what we initially learned very fast, how we then constructed that into our citywide response, and a little bit about what that means for, as our strategies have adapted over time, what that means for the future as well, and what some of the lessons we've learned, will beyond this pandemic will be for New York City. Now, I can't help but on number 4 here also give you a couple of personal reflections along the way Although my biggest personal reflection really is we've done all of this together. Everything I'm about to share with you is our shared work together. It's not my work. It's not any one individual's work. It's what New York City has been able to come together to do. And it really is incredible. So let me tell you a little bit more. Let's dive in. Next slide, please.
Hold on.
Take your time.
Yes. It's not moving. I'm sorry.
So I'll keep going. So as we go into what we citywide did as for our COVID response, I wanted to share a little bit about the backdrop. So I think as Dr. Kay mentioned, I'm a primary care doctor myself. I really view the pandemic through the lens. I come to my clinic every week, and I've continued to see my patients throughout the pandemic. I've never stopped, and I always see the world through the lens of my patients in terms of what they go through and what they've been through for the pandemic. My patients are all in the Bronx. I am at our Morrisania Community Health Center. So I've been on the front lines since March and April of 2020, when I can recall. I had the scariest moments of any point during the pandemic then. And it was March of 2020. We were seeing cases really sharply rise in New York City. And I got a call on Sunday from my boss, Mitch Katz. And at that point, we saw cases really sharply rising. We were the epicenter of the epicenter. We built out we quickly constructed new space for intensive care units. We got all the ventilators that we needed for all the patients that we believed could come through our doors. But we had a problem. And this is what my boss was calling me about on Sunday afternoon. He said, "Ted, we have a problem." No, when he says we have a problem, we have a real problem. He said, "We're out of doctors." And I was thinking to myself, that is a problem. And it was one of those moments in my life that I know you all have experienced in different ways, where you realize that you really can't fail, because the thought of what failure would look like is so devastating. It's almost paralyzing. So I knew we had to succeed, but I had not a clue how. So I took some time, I thought about it, and we were able to actually make a national call for volunteers to come. We'd fly them in, pay for their hotel stay. We went through vendors, anybody that would send us doctors that we were able to pay for. And the US military served a really big role here too. A couple of quick stories about it. Some volunteers that came to New York City to help us in our time of greatest need. One of them was a surgeon at Woodhull. And keep in mind, surgery wasn't the key need during COVID, but he came and did whatever he needed to do to help. And we asked him, why did you come and stay for 3 weeks? And he said, "Forgive me, I don't mean to use an expletive. This is a quote though." He said that Woodhull trained me to be a badass surgeon. So when I saw what was happening in my city, I took the first flight over to help. So another doctor at Elmhurst Hospital stayed for 4 weeks. We asked him, what brought you here? What made you stay? And he said, when he was reading about COVID, he got a call from God to come to Elmhurst Hospital. And this was his calling in life. And he stayed for unpaid for weeks on end just to help his city, even though he had moved away. And then the US military, I think you may remember, there was something called the USNS Comfort. For anybody that thinks back, that was a big ship. The concept of the ship at the time was to make it into a big mobile, basically ICU, series of intensive care units on a ship. Very interesting idea. And when the ship was coming into the harbor, I got to give a lot of credit as I think back. I'm very humbled by, at the time when we were learning together, the ability of others to listen, to take a minute and to listen, and to see the big changes that were able to be made. When the ship was coming in the harbor, this is the same time I was desperately trying to bring as many doctors as I could from across the country into New York City to help us in our time of greatest need. And this ship was bringing a ton of hundreds of medical staff with them. And somebody from the military, one of the generals, pulled me aside and said, basically, is this a good idea? Should we be doing this on the ship? And it was one of those, again, moments in my life that I know you've experienced where it was like, thank God somebody's asking me, who's been on the front lines for the last month, what I want, what I need, because I feel like I know. And I was waiting for somebody to ask. And I said, no, we should not do this. What we should do is you should take all of those staff and we should put them into my 11 hospitals that have built out our ICUs already, or where our patients trust, where their families will send them. That's where we need the help. He said, okay. And that changed our plans as a city, as a country. We then were able to deploy the military staff. I think it was in the end something like 750 members to our 11 hospitals. And the processions of the U.S. military coming in our time of greatest need through our doors at Bellevue Hospital, there has been nothing like that in terms of reinvigorating our staff that I've ever seen. They literally saved the day. So I have eternal gratitude to our military for coming to us and really serving in our time of greatest need. So between the U.S. military, us working together as a city, the military really listening to us, bringing in volunteers, bringing in as many people as we could hire to come in. We were able to bring in several thousand medical staff in a matter of weeks. And we never had a patient that went without a ventilator. So we pulled through. It wasn't easy, but we did it as a city. And at that point, go to the next slide. I thought to myself, this is April of 2020 now. This has been one of the most harrowing, humbling experiences I've ever had. Seeing this from the frontline perspective, supporting our hospitals. We can never do this again. This is the only time we can ever have New York City go through this. And I felt such a strong conviction to do everything in my power to prevent our city from going back to what March and April of 2020 were. And at that point, our city was thinking about how we were going to build out the ongoing response to COVID to prevent this from ever happening again. And that was the genesis of the New York City Test and Trace Corps. On June 1st of 2020, we officially launched the Test and Trace Corps. And our mission was to keep the virus suppressed as long as we could, but knowing that there would be other waves. We knew this from the beginning. We needed to delay them, so hold the line as long as we could through the tools we had in our tool belt at that time, which were predominantly testing and contact tracing and helping people to isolate. We need to diminish or keep a lid on what any future waves would look like, because every day that goes by that we prevent cases from rising more than they did, that translates concretely into lives saved. And I'm very proud of the work we've done as a city coming together. That's what I want to tell you about now. So go to the next slide. So the way that we formed the New York City Test and Trace Corps from the very beginning is we had three discrete elements here that were linked together. We wanted to test as many people as possible, and I'll go into more detail in the subsequent slides for this. But some upshots are we've developed more than 1,000 testing sites over the last 2 years. It's always been free. We've never charged patients for testing. We've really tried to bring testing to where you are. And as Professor Kay said, one of the things I'm most proud of is how we've been able to really work together through her lens and through others' lenses, through our community advisory board, through our community-based organizations, to really know exactly where we need to bring testing. And that's been, I think, our secret ingredient to success. We've done more per capita testing than almost any other country in the whole world. And that's because whenever Professor K or anybody else from our communities comes to me and says, can we have testing? The answer is always yes. Only thing I ask in return is you have to give me the exact coordinates on the map. I want to know where to park, because you know better than I do where we need to bring testing. And that's been, I think, our secret ingredient to how we've really been able to achieve what we have together. This is actually a little bit outdated here. Citywide testing capacity, I put 120K here. I can tell you during Omicron, we got up to 250K in a single day. So we were able to expand to levels that were almost unfathomable back in June of 2020. From a contact tracing standpoint, and I'll again go into more detail in just a moment about what contact tracing is, but in a nutshell, we were able to bring together this amazing team of 4,000 New Yorkers that were the ones to raise their hands coming out of the devastation of March and April of 2020. Other places, contact tracers are the people that call you if you have a positive test. In New York City, see how you're doing, see how we can help, and ask the sensitive question of who could you have exposed? Because they're at the highest risk of developing COVID. And if we reach them early enough, we can get them to stay at home or come to our hotel so that if they become infectious, they didn't go and infect other people that could have been prevented. It's an effective tool. We've used it for many years for other diseases, but it's built on trust. And again, it comes back to, how can we build trust among our communities? Because if you have the wrong people calling New Yorkers, if you want New Yorkers to do anything, you have to show value. There's no legal obligation. You can hang up the phone, but I'm about to share with you some statistics about how much trust we've as a city been able to build among fellow New Yorkers. And I think the secret ingredient here is the people that did the work. It's not me. It's the 4,000 contact tracers that raised their hands that are almost all from our hardest hit communities across New York City that speak 50 languages. They're not, our contact tracers are our communities. So if somebody's knocking on your door, it's somebody that lives near you. It's not somebody that's never been to New York City before. And it's somebody that went through the same things you did in your community back in March and April of 2020. And I think that for sure that's been a secret ingredient to our success there in terms of being able to keep a lid on the waves that we've seen since March, April of 2020. The third thing here is a little bit of the New York City flavor of, my patients really do influence me. I remember back early in March and April of 2020, some of the common feedback I got from my patients in the Bronx was, okay, so when I diagnosed my patients with COVID, they would tell me, okay, I have the virus that I've been reading about in the news. Okay, I'm feeling okay. Fortunately, for most of my patients, that was the case. But I live in a multi-generation home and I have to work tomorrow. So Dr. Long, draw me a picture of how I'm supposed to isolate when we have one room that I sleep in with, my child or, my spouse. We don't have another room. Grandmother's in the other room. A lot of patients work off the books. A lot of them work at night the following day. So how am I supposed to make the false choice between going to work if I know I shouldn't, but if I don't go to work, I can't support my family? I'll walk you through in a minute. We based on the feedback my patients gave me, we actually were able to solve in New York City all of these issues doing innovative things that nobody else across the country did. That's to me is our New York City flavor of how we've been able to really come together to fight back. But let me go into more detail on each of these. So let's go to the next slide. So in terms of the effect of all of this, you could see here in March and April of 2020, the big rise here is the rise in cases that we were seeing. When we launched Test, Trace, and Take Care, or our ability to actually help people to get through this, we were able to actually keep our cases down. And I'll show you some more data in a moment for longer than most other cities in the country. And you could see here, we kept cases at a very low level, almost 200 per day in the largest city in the country for a very long time, for several months. And the way that we did that was through doing more testing than anybody else did, through contact tracing, and through giving people an actual way to isolate or quarantine in the context of their lives, and not just say, you live in a multi-generation home and have to work to support your family, good luck. We've from the very beginning listened and built out how we can help you over time. And I'll tell you some more examples of that in a moment. So let's go to the next slide. So for testing here, throughout, one of the lessons I've learned is testing is so as they say in real estate, it's about location, location, location. If you build a big testing site in the wrong location, people will not come. We experienced that early on. When we started to work with our communities to decide together where to build testing or where to put our mobile units so we can move them around and be in multiple places at once, over the course of a week, that's when we really started to really make a difference in terms of bringing testing to everybody across New York City equitably and at much higher levels than other cities in the country. So we looked in other ways we've been able to guide our testing effort is we've been in lockstep with the Department of Health. So they have these sophisticated ways of determining where testing is lower, but cases are rising higher. So that's where we'd want to preferentially put testing, and then we'd be able to work with communities in those areas. That's something called the SAT scan. And we've also looked at high-risk workforces, high-risk populations. We've brought testing specifically to NYCHA buildings, specifically to homeless shelters. Then over time, as we've heard about other needs, we've even built home testing programs where today it still exists. If you are a close contact, immunocompromised, or 65 or above, I can send a testing team to your house for free to do a PCR test on you. We're the only place in the country that does services like that, where we can really pull out the stops to make sure that every New Yorker, without exception, has good and equitable access to testing. We also, early on, one of the lessons I learned, so let's make one more point in this slide, is we were starting to see that other parts of the country were experiencing long turnaround times. And one of the things I learned with COVID is when somebody gets a test, you really have to get them a result back fast to help to guide what they're going to do, because in order to have somebody stay home and not go to work, you have to tell them if they're positive. And that also, you have to get somebody a test result back fast to know who they expose, so you can actually get them early enough so they haven't become infectious themselves. That basically translates into needing to give a lab turnaround of about 24 hours or less. Seen across the country, back in the summer of 2020, there was a week plus wait times in many cities. That's not compatible with effectively fighting COVID. So what we did in New York City is, again, as we do, took matters into our own hands. So one of the things we did is we built our own lab. We call it PEARL, or PRL, Pandemic Response Lab. And what we do there is all of my testing sites, instead of outsourcing testing to places outside of New York City, we go to our New York City lab. So we've been able to tightly control lab turnaround times in New York City throughout the pandemic in a way that no other city has. So that's why when you come to any of my testing sites, you always get a fast turnaround time. And today, I was checked last week, that this is not an exaggeration. The turnaround time right now in New York City at any of my sites is 10 hours. 10 hours for a PCR test. And my sites do rapid tests. So, that's been a big priority for us, but it's not a coincidence that happened. It really did require us to build out our own lab so that we didn't have to experience the wait times that other cities that were reliant on national vendors did. On this slide here is another really important lesson learned. This goes back to location. We launched in July of 2020, 10 mobile units, again, working as, with Professor K, with our community advisory board, with community-based organizations. And this is where I, again, ask people, tell me, where exactly you want me to park my vehicle? That's where we'll be tomorrow. It worked really well, and we were able to really bring testing to populations of people that didn't have access to testing before. And we knew that because we were seeing testing or cases rise in certain communities like Sunset Park in the summer of 2020. In Sunset Park, where we brought in rapid tests, mobile testing units, really got the word out working with community-based organizations, they had a higher rate than other parts of the city. We drove down their percent positivity by 2/3 in 2 or 3 weeks by having this focused effort of being in the right places, working with the right community-based organizations. Then to try the model further, we're seeing the same thing in Soundview in the Bronx. Did the same thing there, drove the percent positivity down by the identical 2/3. So we were pretty convinced that this is a good model, it was working well. So we went all in. And today I think we have 87 mobile units. So we have 8 times the amount of mobile units we did in July of 2020. And we've armed them with rapid testing because that was something people valued over time. We even for a while armed them with saliva testing, and several of them, 30 of them today, we actually do testing or vaccines. So we've really tried to sort of learn as we go here. And as we've seen something successful like our mobile units, we heavily invest in and deploy those resources moving forward. This has been a success story for us here in terms of keeping things grassroots, community-based, and being able to deliver on our promise of truly being able to bring testing to your doorstep in your community.
Long. Can I remind you of time? It's 12:55.
Yes. Okay. So, I am known to talk at great speed, so I'll try to go in.
And I hope that, yes, I know, and I hope that we will see one of testing vans or maybe vaccination vans during our Brooklyn College Fair. So the discussions are being advanced, and depends on the situation in the city. Yes, we are very glad to see you and to welcome one of the vans. Thank you.
Good. Okay, so Professor K is very politely saying I have 10 more minutes to get through my slides, so we save time for Q&A. So let's go to the next slide. Contact tracing I talked about already, and this just breaks down to a little more detail, and we'll share the slides afterwards, how we configured it in New York City. But let me cut to the chase. In a couple of slides, I'm going to show you our key results that are is what New Yorkers have done for other New Yorkers. So let's go to the next slide. Just a couple of other innovations along the way. And these are things that we've done to help New Yorkers that have strongly been driven by what my patients tell me they need and what people that we're doing contact tracing for tell us that they need, or what their contacts or people they exposed when we call them tell us they need. So to highlight a couple, early on, we knew we needed an alternative to having people stay home. So we've had a free hotel program throughout COVID. We've sent more than 2 million meals to people at home, so that the most common reason you have to leave your home is to get food. So we've been able to solve that by sending out more than 2 million meals. We've created special roles called resource navigators, where we are able to figure out what you need and help you with exactly that. We've also brought testing to the hotels, giving free cell phones out if that's the way that people need to communicate so they can stay home. And we've been able to arrange things like monoclonal antibody treatments, and today Paxlovid, or we can even through a warm handoff get you a delivery of this life-saving medication to your home. Next slide. So some other innovations, when we started to think about the link between contact tracing and how we can give people resources, we did a couple of other creative things. For example, if you're taking a rapid test, why wait for the result to come back into the system so that we call you? Why don't we just, for everybody that's a positive rapid test, just come over here, spend a few minutes with us. We'll ask you what resources you need in person in that very moment, and we'll ask you who you could have exposed so that an hour later we can call them. So speed has been very important. We've been able to develop different innovative strategies like that. We call it an accelerated contact tracing model that's unique to New York City, but helps us move faster than everybody else. One other thing I have to highlight here is the fourth one down. This is so important to us here, cash assistance. So for anybody that there's a state law that says if you're on the books, your employer has to pay you for sick time if you have COVID. But if you're off the books, that doesn't apply to you. And in New York City, this is something very important to us from an equity standpoint, that we want to give everybody the equitable opportunity to have the choice to stay home. It's a false choice if you're telling somebody you go to work and risk infecting people, or you stay home and lose your apartment. That's not a choice. So in New York City, we've been able to solve that by getting a multi-million-dollar grant, which I'm eternally thankful for, so that as we're figuring out with you what you need, we can offer people to qualify. So people that are working off the books, for example, direct cash assistance to stay home if you're a case or if you've been exposed. So I'm so proud of that, because it's an example of how we've been able to hear what people's most important issues are, and being able to solve something that was very hard to solve. But in New York City, we did solve it. So my patients that are off the books, I'm giving them a real choice now. Next slide, please. So this slide is just making the point that as we've been identifying contacts or people that people with COVID tell us they've exposed, over time, they really have been the highest risk for themselves developing COVID. They have a 3 times the risk of other people they're getting tested of actually having COVID. So contact tracing has definitely identified the right people. And then everything else I've told you about how we help you to stay home has how we've been able to break chains of transmission. Next slide, please. Other things that we've learned along the way, and I won't go into great detail for this, but I'm super proud that we've been the first big city in the country to reopen our schools in September of 2020. And we were the only big city in the country to reopen our schools in January of 2022 at the height of Omicron. Under Mayor Adams, we had a plan for sending kids home with home tests. We've given out 7 million to date so that you can know before you come back to school if you've been in the classroom with somebody with COVID, whether you yourself have COVID. It's made an incredible difference. And we in New York City have proven time and time again that our schools are actually the safest place for kids to be and teachers to be. And not only are schools the safest place, but as the father of 2 small children myself, what is more important than an in-person education in the safest place for my kids to be? Nothing. Next slide, please. So as we've been learning as we go, we then encountered the second wave in December of 2021, or actually rather December of 2020, I'm sorry. And we indeed held the line. We went into the second wave later than comparable cities, and we had much lower per capita case counts at the peak than other cities did because of everything I've told you so far. Next slide. So I want to tell you a little bit more about some of the effects of what we've been able to do. So the first one is something I'm very proud of here. Through December 11th, so right before Omicron, we've been able to reach through contact tracing 9 out of every 10 cases through all of COVID. 89% of everybody with COVID, we've been able to reach through our contact tracing team. And that's because I'm convinced people trust us. People don't have to pick up the phone when we call. It says test and trace calling. There's no obligation, but people choose to. And if you don't pick up the phone in New York City, we send a team we call them community engagement specialists, that are people from your community that will go knock on your door, check in with you, see how you're doing. And that's our way of reaching you there too. We're the only place I'm familiar with that goes that far. But it's resulted in us being able to help an incredible number of New Yorkers. And again, reaching 9 out of every 10. And then through that, the third number here is bolded. I'll give you more reason. I have yesterday's number off the top of my head. Today, throughout COVID, we've actually been able to identify 1.8 million New Yorkers that have had a direct and identified exposure to COVID that we've had the opportunity to call. That's 1.8 million people at the highest possible risk of developing COVID that we've had the opportunity to call before they got infectious. I mean, that's what this is all about. So the fact that we've been so successful, there was some at the beginning of this that said we'd get 0 people. Nobody would tell us who they exposed. That's not true. People shared with us 1.8 million people that they exposed. And that just really, to me, I'm so proud of our contact tracers who've been able to build the trust from our communities so that people want to share this information with us. It's sensitive, but 1.8 million times, that's been the number of opportunities we've created in New York City to make a difference. Next slide, please. So I'm gonna go very fast through the rest here. Most of it's pictures. So as we've gone along with mobile units for testing, we've said to ourselves, well, hey, why don't we do the same thing for vaccines? We have, and it's been very effective. So we bring our mobile units around, working with our communities to bring vaccines anywhere. I like the picture on the bottom here because I'm pretty sure we're illegally parked. But it's okay because it's New York City, and we're bringing the vaccine to the restaurant there. So we really just we park wherever people tell us to. And this was so effective in terms of bringing vaccine to people that we became the first city as well to universally offer to deliver a vaccine to you in your home. So you could go to nyc.gov/home vaccine. You can still do this today. We'll come to your home, do the vaccine for you. No problem. Anything you need. Next slide, please. So one statistic that we should all be proud of is that 97% of adults in New York City have received at least 1 dose of the vaccine. 97%. I remember when we started doing this, I was hoping, I was just going to celebrate when we got to 10%. 97%. I'm just so impressed by how we've been able to come together as a city. I'm just really humbled whenever I read that statistic, because that's so many people making the choice to protect our city. Next slide, please. So Omicron started early December of 2021. Next slide, please. And we adapted as we went. So when we went into Omicron, these were our testing sites. We had strong lab turnaround times, but we saw testing demand really sharply rise. So I'll skip to the next slide. It's pictures to show you the effect of it. So during Omicron, test and trace, we tripled the number of testing sites we had across New York City while always bringing them to where our communities told us they were needed the most. So the left-hand side, you can see pre-Omicron. The right-hand side, you can see triple the number of sites during Omicron, and we really blanketed ourselves across New York City. Next slide, please. So as we were seeing surge numbers go up, we again did things like we shifted to texting cases right away, texting people that had been exposed right away, developing self-service online tools, and continuing to offer things like food delivery and our hotel program throughout to do everything we could to help New Yorkers. Next slide, please. So 3 things I just want to mention about what's next, and then I'll go to Q&A. One thing I've learned is that the best way to help, probably to help anybody, is to meet somebody where they are. It's a good principle of life. And this has been especially true for some of our most vulnerable New Yorkers, including people that are experiencing homelessness and living on the street. So what we did is that we tried this out, and it was so successful, we've grown rapidly. We built a street health program called our Street Health Outreach and Wellness Program, where we can bring vaccines with roving teams to people across New York City, wherever you are. I've been a part of our team where we've been able to administer a vaccine to a homeless person who was sleeping on his part of the sidewalk. He sat up. We didn't make him come to one of our clinics. We gave him the vaccine right there because that's what he needed. That's what he told us he needed to get vaccinated. He wasn't opposed to the vaccine. We wanted us to meet him where he was. So we did. And it's been so successful that we're continuing to actually build out this program today to support Mayor Adams' Subway Safe Plan. We're very much looking forward to, again, being that linkage to being able to meet people where they are for primary care services, COVID services, or you name it. We even have food packs. Whatever you need, we're going to meet you where you are. And we're going to keep doing that past COVID. Next slide, please. Another thing is our contact tracers have been such incredible people from our communities that I'm really proud to say today that we've been able to transition a substantial number of my contact tracers into be community health workers, to take all of the skills they've developed over the last 2 years and engaging with their community. Instead of engaging to fight COVID now, it's engaging to fight chronic disease, to fight diabetes. And nobody's more equipped to do this than my contact tracers who have become world experts in it over the last 2 years. So this program has now been launched. We have community health workers at all of my big clinics across New York City. It's a young program, but I've been very impressed with it so far. And this is one of those things where we're going to be stronger than we ever were before, being able to have me and my clinic help my patients beyond the four walls of my clinic with world experts. And we could only do it because of what we've been able to do coming together as a city for COVID. Next slide, please. Finally, and this is beyond today, but I just wanted to say a couple words about it. Long COVID is going to be a very important thing for us to have a laser focus on moving forward. And I built 3 centers of excellence, which are these new centers. Is a picture from my center of excellence in the Bronx, where we specialize in bringing all of the evidence, what we understand about long COVID, to be able to deliver all of that care to you in a one-stop shop experience where you can bring your family to for general primary care, all in one roof. My goal here is to make this an inviting environment, because what keeps me up at night is my patients who have long COVID, and it deeply bothers me seeing my patients having to go through this. I'm able to help them. But there's a lot of New Yorkers that don't have me as their doctor that do have long COVID and aren't sure if it's something real, if it's something that just they're experiencing. I'm here to tell you today, long COVID is real, and we need to take it very seriously. And that's why we've created, through Test and Trace, a program called Aftercare, where we've reached 9 out of every 10 New Yorkers with COVID before. We're going to reach you again. We're going to do another full round of phone calls all across New York City to see how you're doing now. And if you're still struggling with lingering symptoms, you can come to this site you see right here on this screen, and we're going to help you. So with that, sorry I talked at great speeds near the end there. It's just a lot I wanted to share with you today. And again, thank you for having me. I've been very excited to join you today. And thank you especially to Professor K for inviting me. I'm honored to be here. And I'd love to take the next 5, maybe 10 minutes to answer questions. So I'll give the floor back to you, Dr. K.
So thank you so much, Dr. Long, that you do speak very quickly, but very studied with detail. So we have some questions from our students, and I want to try and get to diversity of questions. I have fielded some of them in the chat, like the data points that I can look up. So one of the questions is from, and forgive me if I mispronounce the name, but Faner Hossain, who asks, what drives you to do this much for the city?
Well, thank you for the question. From the heart, it was that moment in March and April of 2020 where I had done everything that my body could to help our city. And I just knew at that point, we can never go back to seeing our city go through something like this again. And I just view it as my mission in life to prevent our city from going back to March and April of 2020. And I will continue to do everything in my power to prevent that. Now, I don't think we're going to now. I think we're in a much better place. But throughout, my mind immediately goes back to being at Lincoln Hospital and in the ICU and remembering what I saw and remembering that if we work together, we can prevent this. Thank you for the question.
Yeah, thank you. And I just want you to look at the chat because there's also a lot of thank you notes to you. Another question that we have is, how do we, so you talked about how well the staff who worked on this event are now, their skill set. But how can we best as a department who train the next generations of practitioners and researchers, how can we best prepare our graduates to be ready for this type of emergency response?
Yeah, that's a great question. I mean, I think one of the things that I've learned through COVID is that this is the royal we, meaning all of us in different ways, have to maintain pandemic preparedness. And what I mean by that is there's standard public health tools that we need to keep warm. For example, with the Public Health Corps, I'm planning to have ongoing, at least biannually, continued trainings about what's going on with COVID, or, with things like contact tracing, how do we use it for other diseases? So that if we do need to flip the switch, I have a team ready that's done it before, can do it again, to jump back into action to keep our city safe. And I think it's worth, and we've created something called the Pandemic Response Institute as well, us as a city thinking through more ways that we can all contribute to ongoing pandemic preparedness. But I think we can't just say COVID's over, we're going to move on now. COVID's not over, although I think we're in a much better place. But we do need to, I think, keep working together as a city to have the right tools sort of ready to be reactivated. And the tools I've learned largely are us.
If I may add something to this while Professor Margaret Horek will prepare the next question. Some of our alumni and students actually have responded to those early invitations to join Test and Trace. And actually, we do have our Brooklyn College representatives in the who are speaking in my classes. So some are tracers, some are resource navigators. I had also somebody who worked in the pod, vaccination pod, and also, I'm sorry for jargon, and also even those community canvassers. Those jobs were available and they were temporary, but some students responded to that. We actually got invitation from the New York State Department of Health to actually join to prepare students for summer employment in the public health corps. So I hope that it's going to be collaboration between the city and the state. So I strongly advise students to reach out to your professors, and we will definitely send the announcement about that. So thank you for that.
Excellent.
Thank you. We have another question. Someone who is, Carolina asks is, we heard about what went well. We're curious about what you think our points of failure were and how to prevent those in a future pandemic.
Great question. You mean our points of learning, of course, right? So I'll give you an example, and this is very instructive for me. This is June of 2020. And we opened this big testing site in Washington Heights. And I remember, because I went there for the ribbon cutting of it, it was like a moon landing. We set up these gray tents, like from Apollo 13 or whatever. I don't know if I've actually seen the movie. But like on the, I don't know if they go to the moon or not, but it's like in this like big pool area where it looked like very fancy looking, capacity to do a tremendous number of tests, all free for the community there, or anybody that came would want to come. And I remember I was there opening day, I was looking around, where is everybody? And people didn't really come. And I racked my mind, I was like, well, but people want to get tested. We have this site that can test so many people. And I had my team, because people weren't coming, go into the community and just ask people, why are you not coming to get tested? And we got such interesting responses were, is it true that if we come to your site, we can get COVID? No, that's not true. Well, nobody's told me about this site. I go to church, I work with this community-based organization. They don't know about this. And I learned so vividly that day really, that it really has to be grassroots. And I think that pertains to contact tracing, it pertains to resource navigation, and it certainly pertains to testing. You could build a big site. If you build it, they will not come. And I learned a lot from that experience. And that was one of the things that triggered me to build our mobile fleet, the first 10 units, was I said, okay, we can fix this. We can work with our community to know where to build the next site. And we can work with our community advisory board to figure out how to message this. And then our community-based organizations can be the trusted messengers. When we started to use that as our formula, that was a winning formula. But the reason we went down that road was we had the opportunity for learning that if you build it, they will not come.
So thank you, Dr. Long. We know that you have to skip out for your next appointment. So I want to thank everyone for attending. We had a great showing. We had far more people attend than registered in advance. So that's a great success. So in this case, people actually did come, Dr. Long. So we figured out how to mobilize our campus, and we also have people attending from elsewhere in the CUNY network. So I want to thank everyone across the board for attending. And we will, yes, we are going to host more talks, more conversations about COVID and other public health issues that affect our city. So once again, thank you, Dr. Long, for your time and expertise. Maybe we can have you back again.
I'd love to. It's an honor to be with you all today. Thank you for being willing to listen to me. Have a great day. I'd love to come back anytime.
Thank you. And thank you for all the fabulous, enthusiastic work to really address this unprecedented event, and that we hope we'll never have to face again, but we probably have to be ready to do it.
Agreed. We'll be ready.
Thank you, everyone.
Thank you.
Take care.